My name is Marites Tagadas. I am a caregiving student of SAS in Las Piñas. Today I am going to perform a complete bed bath. A bed bath is a wash that is given to someone who cannot leave their bed. There are 4 purposes of bed bath. First is to remove transient microorganisms, body secretions, excretions, and dead skin cells. Second, to promote comfort and relaxation. Third, to stimulate circulation of the skin. Fourth is to prevent or eliminate unpleasant body odors. To perform a complete bed bath, first you need to identify your client and explain the procedure to ensure client's cooperation. Good morning, sir. My name is Marites Tagadas. I am your caregiving student for today. I am going to perform your complete bed bath. To maintain your personal hygiene, can I check your name, sir? May I see your name tag, please? Can I touch your hand? So you're Mr. Frigi Kumita. Can I call you Mr. Kumeta? Do you have any questions, sir? Can we proceed now? Wash hands before the procedure to prevent cross-contamination and spread of microorganisms. Show you how to wash your hands with water, with soap. Make sure that it is washed properly. And dry our hands using a clean, dry cloth. Remove unnecessary articles on the bed and clear up the work area. Sir, I will put your cell phone here. Then, arrange all articles needed within reach. Line up a chair or table with a newspaper or piece of rubber or plastic where the basin is to place. Like what I am doing here, I put some newspaper where the basin is placed. Provide privacy. Draw the curtains, lock the door, or put sign outside the door. This is to ensure client's privacy. Close window and air conditioning unit to prevent hypothermia. Since the electric fan is on, we are going to off this one. Raise the bed at a comfortable working height. Raise the side rails. This promotes proper body mechanics and reduces strain at the caregiver's back. The side rails will serve as protection for the client from falling. Invite a family member or significant other to participate if desired. Offer bed pad or urinal as desired. Wash hands, then put gloves. This promotes client comfort during procedure. Loosen the top sheet. Assist the client to the side of the bed. Remove clothing or gown while the top sheet is in place, covering the client. When removing the gown, turn the client towards you, then untie the gown. Position the client supine, then remove the gown by rolling it inward. Fill the 2 bath basin 1/2 to 3/4 full of comfortable warm water. Combine the hot water with tap water until the desired temperature is achieved. Warm water is used during bath. This is to promote comfort, relaxes muscles, and prevent unnecessary chilling. Combine hot water with tap water. Until the desired temperature is achieved. Then check it. Place the bath blanket over the top of the sheet. Roll down top sheet under the bath blanket. Putting bath blanket provides warmth and privacy. Sir, I'm going to put the bath blanket. Spread the bath towel across the bed under the client's head. Placement of bath towels prevents soiling of bed linen and bath blanket. Malcolm. Excuse Mr. Cometa. Wrap the palm and fingers to form a mitt. A mitt retains water and heat better than loosely held washcloth. Wet the cloth or face towel and squeeze out excess water. This is how we are going to form a mitt. When cleaning the eyes, wipe from inner to outer canthus with water only. Use separate corner of the towel. Ask whether the client wants soap on the face. Soap irritates the eyes. Using separate section of the mitt reduces transmission of infection. Bathing eye from inner to outer canthus prevents secretion to enter nasolacrimal duct. From inner to outer canthus. From inner to outer canthus. Do you want soap, sir, to your eyes? Soap. Inner canthus to outer canthus. Rinse. And pat dry. Use firm strokes. Wash the face, neck, ears. Rinse the area 2 to 3 times if soap is used. Then pat dry with towel. Then remove wet towel after patting. Ask clients prefers to have soap used on face. Soap tend to dry face. Face, nose, neck, ears. Is the way. Then, and pat dry. Expose patient's father arm and spread the towel lengthwise under the arm. Excuse me, Mr. Cometa. Arm, sir. Wash, rinse, dry, paying particular attention to the axilla using long firm strokes from distal to proximal, from wrist to the shoulders. Long firm strokes stimulate circulation. Top, outer, inner, under. So, top, outer, inner, under. Rinse. Top, outer, inner, under. Then pat dry. Top, outer, inner, under. Then pay attention to the axilla. Place the basin on the side near the edge of the bed and wash hands, paying attention to the spaces between fingers and nails. Do the same on the arm near you. Then change water. Pat dry the hands, then remove the bath towel. Wait. Wait, sir. Brush the nails. Then do it on the arms near you. Fold bath blanket down to the pubic area. Place a bath towel over the chest and abdomen lengthwise. Lift the bath towel off the chest and wash the chest and abdomen. With long, firm strokes, giving the special attention to the area beneath the breast and umbilicus. Rinse and dry well. Rinse. Pat dry. Soap. Rinse. Then pat. Replace the bath towel when the areas have been dried. Powder, especially the neck and under the breast. Expose the thigh, leg, and foot on the far side. Drape the portion of the top sheet around the groin. Flex the knee and spread the bath towel under the entire leg. Wash, rinse, dry up to the ankle. To the inguinal and popliteal areas from distal to proximal using long, firm strokes. Dripping prevents unnecessary exposure of body parts. Top, outer, inner, under. Then pat dry. Repeat the same on the leg near you. Top, outer, inner, under. Soap. Top, outer, inner, under. Top, outer, inner, under. Then pat dry. Flex both knee and drape. Place the best hand on the towel between legs. Lift further foot with heel in the palm of the hand and immerse it slowly into the water, with leg resting in the bended elbows. Wash, rinse, dry well between the toes. Do the same to the other foot near you. To support during lifting of joint and extremities, prevent strain on musculoskeletal structures. So Mr. Frigid, flex the knee please. Wash, rinse, and pat dry. Okay, the other side. Wash, rinse, pat and dry. Change the water, raise the side rails. Lower the side rails, assist the client to turn to side with back facing the other side, and spread both towel on the bed, close the body. Expose the entire back, then wash, rinse from the nape to the posterior upper thigh, using long firm strokes, pat dry. Long firm stroke. Soap. Rinse. Rub the back with powder or lotion as desired. When using the powder, don't spread it directly to the client's back. Put a small amount onto the palm away from the client. Then spread it the entire client's back. Moisturizing lotion prevents dry. Okay, we're going to put effervescent oil. Assist the client to supine position. When you lay down. Assist the client with grooming aids such as powder, lotion, and deodorant. Use powder sparingly. What do you want, Sir Freddy? Tawas or deodorant? Deodorant? Okay, can you use it with your own? Assist in putting the client's gown. Make an occupied bed. Place dirty linen to hamper, clean and return. Use equipment and leave the unit in order. Wash hands, document the procedure and client's response to the procedure.